Thank you, APT Medical, for your invitation to work in this workshop. Title Managing Tortuosity in Complex PCI Strategies and Research. My name is Dr. Jose Linares from the Lozano Nobleza University Hospital. What are the objectives of this session? To know the technical rationale for using NC lollipop balloons, like the CONQUEROR non-compliant balloon, and to understand the efficacy of the CONQUEROR NC balloon for stent pulse dilatation in complex PCI and coronary tortuosity. Well, what's the rationale for using this type of balloons? Well, as you all know, optimal stent expansion and position are key to improve patient outcomes, and post-dilatation with non-compliant balloons are related to better stent expansion, less complications, and lower target lesion failure at follow-up. However, non-compliant balloons have worse navigability than semi-compliant balloons, and this could be a big issue in cases of severe tortuosity, severe calcification, or in cases of stent malapposition. Particularly in cases of stent malapposition, we can have a big problem with tapered tip balloons, as the tip of the balloon can collide against the stent struts, blocking the advance of the device into the stent when we need to post-dilate the stent. If we push stronger in these cases, we can lead to a stent mechanical complication and a big trouble ahead. And the CONQUEROR NC balloon has an innovative design based in an spherical tube, as you can see here. It's a particular visualization in fluoroscopy. And what conditions this spherical tip? Well, despite an increased crossing profile, the spherical tip conditions are decomposition of the opposite resistance force, facilitating the advance of the device into the stents. So in order to prove this theoretical assumption, we designed a technical study of stent pulse dilatation with this new device. The study was called EPICO 2 Reconquista. The study was carried out in Spain across 20 centers, and 250 patients were included, and the device was used in 263 lesions. The hypothesis was that CONQUEROR NC spherical tip would have a high success rate, over 80%, used as first option, or even of utmost importance, and increased success rates over 30% after a regular non-compliant balloon failure, after a tapered tip non-compliant balloon failure. Okay? The primary endpoint was technical success, quite simple, just defined like advance the device to the in-stent segment to be post-dilated. Obviously, there were other secondary endpoints like angiographic success, if there was no significant residual stenosis and normal blood flow, or procedural success if there were no stent mechanical complications or missed during the procedure. The exclusion criteria were vessel size too small or too big, side branch post-dilatation without previous kissing, or identification previous to the use of the CONQUEROR NC balloon of stent mechanical complications, large dissection, coronary perforations, or abnormal blood flow. Well, operators should implant the stent according to the standard daily practice. Operators were encouraged to include complex lesions, and then they should perform stent post-dilatation with a CONQUEROR NC spherical tip balloon. There were two groups. In the first group, the CONQUEROR was used electively as first option, and in the second group, the CONQUEROR was used after the failure of a typed tip balloon. The group was named REC failure. Some considerations in the second group: the CONQUEROR should be or should have the same balloon size, and complex techniques were not permitted if previously not used with the regular NC balloon. The study was recently published in Rec Interventional Cardiology. What are the results? Well, according to AHA lesion classification, 70% of the lesions were complex P2 lesions, and 50% of the lesions presented moderate or severe tortuosity. Severe tortuosity was more frequent in the second group of regular NC balloon failure. Only in 10% of the lesions, complex technique was required to advance the CONQUEROR NC balloon. And the technical success of the CONQUEROR NC spherical tip was very high in as used in first option as well as used after a regular NC failure, nearly 99% in both situations. And this graph shows the most relevant information of the study from my point of view, and that is that in cases of failure of the regular NC balloon, the CONQUEROR NC spherical tip got the technical success in almost all cases, just failed in one case. Well, and what happened with the tortuosity? The tortuosity was defined in the study moderate if more 3 consecutive curvatures between 45 and 90 grades, or severe if any previous curvature to the lesion over 90 grades, or lesion angulation within the stent. Well, 110 lesions presented moderate or severe tortuosity, and as you can see in the graph, the results are similar to the global ones, confirming the usefulness of the device in this clinical scenario. And to understand the results of this study, the best way, the easiest way is see the performance of the device in real cases. This is the first case we included in the study, and the first case I could test the device, and I got astonished, as I told you yesterday. It's not a very tortuous anatomy. It's a long lesion. We implanted a stent. Obviously, there was a proximal severe malapposition due to the vessel size mismatch. We tried to use a regular NC balloon, and as you can see, the balloon doesn't advance, and how the CONQUEROR literally jumps into the stent, permitting an adequate proximal optimization technique and an excellent final result. This is a very complex case of a heavy calcified and angulate bifurcation. We need rotational atherectomy to implant an stent and also proximal malposition. A regular NC balloon didn't cross the lesion, and the CONQUEROR was easily put in place to finish the case with a nice result. This is a case of a typical left circumflex tortuosity anatomy. After stent deployment, a regular NC balloon doesn't cross the lesion, and the CONQUEROR easily passes the lesion and permits the post dilatation. Yes, here is another tortuous distal left circumflex bifurcation lesion. Proximal optimization technique was also mandatory, but that type of tube non-compliant balloon didn't work, and the CONQUEROR easily advanced into the stent, finishing the case without problems. This is the case I showed at the beginning of my presentation. Very tortuous right coronary artery and with a lot of ectasia. We put a stent in the distal segment, but a regular balloon didn't cross over the second curve of the right coronary artery, and how the conqueror spheric tip gets to the lesion easily, finishing the case without complications. This is a very illustrative case of how to avoid a stent mechanical complication. It was a right coronary artery angulated ostial lesion. You can see the bad coaxiality between the catheter and the direction of the lesion. We could implant the stent in a regular way. Obviously, we always perform an aortostial dilatation, but this is a case I did personally. I use a regular NC balloon, and I could feel how the tapered tip balloon crashed into the stent, and I was afraid of having a mechanical complication. And as you can see in the stent boost, a short a conqueror with a spherical tip plays into the stent easily and without problems, permitting an arterial dilatation to finish the case safely. This was a very hard PCI in a STEMI, in a right coronary artery with low of tortuosity, a very big vessel. We finally could implant a long stent, a 4 mm stent, in the middle segment of the right coronary artery, but the IBUS told us that the vessel size was 5 mm. We tried to advance a regular non-compliant balloon. As you can see, it doesn't advance from the first curve, and it happened the same with the conqueror spherical tip balloon, but maintaining the pressure, pushing smoothly. Suddenly, the conqueror jumped into the stent, permitting the post-dilatation and nice final result. And the last case I want to show is a case from the last week. It's a severe two-stent bifurcation instant restenosis in a patient with a two-stent bifurcation technique. We hadn't information about the technique because the patient came from another facility, but there was an evident under expansion in the main branch. We tried to correct the under expansion with a tapered tip balloon. But as you can see, the balloon didn't enter into the stent, and how with some difficulty also, you can see how the guiding catheter goes backwards, but the conqueror with the spherical tip goes into the stent, permitting the correction of the stent under expansion and finalizing the case successfully. So, in conclusions, using spheric tip conqueror non-compliant balloon for stent post-dilatation shows a very high technical success and low complex techniques requirements, saving time and money, so important in our daily practice routine. and it's a useful device to manage coronary tortuosity. Thank you for your attention.